Episode 004: How to Bathe Your Newborn Safely, and 8 Mistakes Parents Should Avoid. The first time you bathe your newborn can feel incredibly overwhelming for many parents. Your baby's body is so small. Their skin is delicate. Their neck is weak, and they can become very slippery when they touch the water. Just a little crying, a sudden movement, or a slight slip in your hands is enough to cause a moment of panic. Many parents wonder if they should bathe their baby every day or just a few times a week. Should the water be hot or just warm? Is baby soap necessary? Should you bathe them before or after a feeding? And how do you clean the umbilical cord area when the stump has not fallen off yet? Bathing a newborn is about more than just cleaning their body. It is also a time for parents to check their skin, look for anything unusual, and help the baby relax. However, some mistakes that seem very small during bath time can cause the baby to get cold, get skin irritations, or even be put in danger. In this video, we will go through the step-by-step process of bathing the newborn. Find the right water temperature, learn how to keep the baby safe, and discuss 8 common mistakes parents need to avoid. Be sure to watch until the end of the video, because we will also share signs on the skin and umbilical cord area that mean your baby needs to be checked by a doctor or healthcare provider. Do newborns need a bath every day? Many parents in Canada believe that newborns must be bathed every single day to stay clean. However, during the first few weeks of life, babies usually do not need a full-body bath every day. Newborns are not crawling, they are not walking, and they are not exposed to much dirt. Bathing too often, especially when using a lot of soap, can strip away the natural oils that protect their skin, leading to dryness. Generally, you can give your baby a full bath about 2 to 3 times a week. On the days you do not give them a bath, you should still clean their face, neck, hands, diaper area, and skin folds using a soft cloth and warm water. If your baby sweats a lot, spits up, has a diaper blowout, or if the weather is very humid, you can clean them more often as needed. The most important thing is not the number of baths, but keeping the baby's body clean, dry, and comfortable. When can you start giving your baby a tub bath? When the umbilical cord stump has not fallen off yet, or the area has not fully healed, parents should prioritize a sponge bath with a warm cloth instead of submerging the baby in a tub. Keeping the umbilical cord area clean and dry helps the stump fall off naturally and reduces the risk of infection. Usually, the cord stump will dry out, turn a dark color, and fall off on its own after 1 to 3 weeks. Parents should never pull, cut, or try to make the cord fall off early, even if it is only hanging on by a tiny thread. Once the cord has fallen off, and the area is dry and healed with no drainage, the baby can be bathed in a tub. If your baby was recently circumcised or had another medical procedure, you should ask your healthcare provider when it is safe to start tub baths. When is the best time to bathe the baby? You can choose any time of day. As long as the room is warm enough, the baby is alert, and the caregiver is not in a rush. It is best not to bathe the baby when they are very hungry, because they may cry and move around a lot. You should also avoid bathing them immediately after a feeding, because changing their position and moving them around can cause them to spit up. Parents can wait a little while after a feeding to let the baby's digestion settle. Some families bathe their baby in the morning, while others choose the evening as part of a bedtime routine. There is no single time that works for every newborn. Choose a time when the baby is usually calm and you can give them your full attention. What do you need to prepare before the bath? Before you bring the baby to the bathing area, you need to have all your supplies within arm's reach. You may need a baby bathtub, 2 soft washcloths, a large hooded towel, a clean diaper, clean clothes, cotton balls or soft gauze, and a gentle cleanser if you plan to use one. Preparation is vital because you must never leave a baby alone in the water, not even for a few seconds. If you forget something, take the baby with you or end the bath. Do not leave the room to get an item while the baby is still in the tub. Remove any sharp jewelry from your hands. Wash your hands and make sure your fingernails will not scratch the baby's skin. The bathroom should be draft-free warm and have no electrical appliances near the water. If you are using a large bathtub, place the baby's tub on a sturdy, stable surface that will not tilt. What is the right water temperature? The bath water for a newborn should be comfortably warm, not hot and not cold. The ideal water temperature is usually close to body temperature, which is around 37 degrees Celsius. If you have a bath thermometer, you can use it to get an accurate reading. If you do not have a thermometer, use the inside of your wrist or your elbow to test the water. The water should feel pleasantly warm, not hot or stinging. Adult hands are more resistant to heat than a newborn's skin. Because of this, checking with just your fingertips might make you think the water is cooler than it actually is. Always put the cold water in the tub first, then add the warm water and stir it well. Always check the water temperature before placing the baby in the tub. Never add hot water while the baby is in the tub, because a stream of hot water could hit the skin directly and cause a burn. The water level only needs to be high enough to clean the baby's body. Do not fill the tub too high, as it increases the risk of slipping. Here is a step-by-step guide to bathing a newborn. First, lay the baby on a flat, sturdy, and safe surface. Undress the baby slowly. You can wrap the baby in a thin towel and only uncover the part of the body you are cleaning to keep them warm. Start by cleaning the face. Use a cotton ball or a corner of a clean cloth dipped in warm water. Squeeze it out and wipe from the inner corner of the eye near the nose toward the outside. Use a different clean part of the cloth for the other eye to avoid spreading any potential irritation or discharge. Gently wipe around the mouth cheeks and behind the ears. Do not stick cotton swabs or anything else deep inside the baby's ears or nose. For the scalp, parents can use a damp cloth to wipe gently. If the baby's hair is oily or dirty, you can use a very small drop of mild baby shampoo. When placing the baby in the tub, one hand must always support the head, neck, and shoulders. The other hand should support the bottom, as you slowly lower the baby into the water, to keep the baby's head and face well above the water level at all times. Use your arm to cradle the baby's head and your hand to firmly hold the armpit furthest from you to prevent slipping. Use your free hand or a soft cloth to wash the chest, belly, arms, legs, and skin folds. Pay special attention to the neck, armpits, elbows, groin, and behind the knees. Milk, sweat, and lint can build up in these areas. When cleaning the diaper area, be very gentle. For baby girls, always wipe from front to back to prevent infection. There is no need to clean deep inside the genitals. For baby boys who are not circumcised, simply clean the outside gently. Do not try to pull back the foreskin. Once the cleaning is done, gently lift the baby out of the tub using both hands. Remember that the baby's body will be very slippery. Immediately wrap the baby in a large towel and pat them dry. Do not rub the skin harshly, as it can damage the baby's thin skin. Mistake number 1. Taking your eyes off the baby for even a few seconds. This is the most dangerous mistake when bathing a newborn. Small children can slip into the water very quickly and cannot lift their own heads. Even a very shallow amount of water can be dangerous if the baby's face and nose are submerged. Parents should never look away, turn their back, answer the phone, or go to grab a towel while the baby is in the tub. Bath seats, rings, or mesh slings are not a substitute for direct adult supervision. Throughout the entire bath, one of the caregiver's hands should always be touching and holding the baby's body. If there is an emergency, pick the baby up, wrap them in a towel, and take them with you. Mistake number 2. Using water that is too hot. Newborn skin is much thinner than adult skin and can burn in a very short amount of time. Some parents use hot water because they are worried the baby will get cold. However, water that is too hot not only causes burns, but also strips away natural skin oils, leaving the skin dry and irritated. Do not place the bathtub directly under a running faucet while the baby is inside. If your home has a water heater, check the settings to ensure it is not set too high, and avoid letting the baby touch the hot water knobs. When in doubt, aim for lukewarm water rather than hot. Mistake number 3, bathing for too long. A newborn bath session does not need to be long. If the baby stays in the water too long, the water will cool down, and the baby's body can lose heat quickly. Newborns cannot regulate their body temperature as well as adults. A baby can get cold, even if the room does not feel cold to you. Parents should bathe the baby quickly, but gently. Usually 5 to 10 minutes is enough for a newborn bath. If the baby's lips turn blue, the skin looks mottled, the hands and feet feel cold, or the baby shivers, take them out. Immediately dry them off and warm them up. Mistake number 4, using too much soap. Newborns generally do not need much soap to get clean. Products with strong fragrances, dyes, or harsh detergents can cause the baby's skin to become dry, red, and itchy. For most baths, warm water alone is enough to clean the baby. When you need to use a cleansing product, choose one that is mild, fragrance-free, and specifically designed for newborns. Use only a tiny amount and rinse it off completely. Try not to switch between many different products at once. If the baby's skin gets irritated, it will be hard for parents to figure out which product caused it. Mistake number 5, scrubbing the baby's skin too hard. Newborn skin is incredibly sensitive. Using a rough washcloth, a hard sponge, or scrubbing too hard can cause scratches, damage, and make the skin prone to infection. When bathing, use your clean hands or a very soft cloth, moving gently over the skin. When drying, pat the skin with a towel instead of rubbing back and forth. Pay close attention to areas where the skin is peeling. Mild skin peeling in the first few days after birth is often a natural occurrence. Parents should not try to pick at or peel off these skin flakes. Mistake number 6, not drying the skin folds. After the bathwater can get trapped in the neck, behind the ears, armpits, groin, and the folds of the arms and legs. If these areas are not dried properly, the trapped moisture can lead to redness, diaper rash, or fungal infections. Gently separate each fold and use a soft towel to pat it dry. For the diaper area, make sure the skin is dry before putting on a new diaper. Do not use baby powder near the baby's face. Small powder particles can get into the air and be inhaled into the baby's lungs. If your baby often gets a rash, change their diaper more frequently. Clean gently and give the skin some time to air dry. Mistake number 7, bathing immediately after a full feeding. Bathing right after a feeding can make the baby uncomfortable and lead to spitting up or vomiting. During a bath, the baby's position is changed. They are lifted up and down, and they might scrunch their legs or cry. These movements put pressure on a stomach that is full of milk. Try to pick a time when the baby is not starving, but has also not just finished a full bottle or breastfeeding session. If the baby suddenly spits up during the bath, keep their head tilted to one side, take them out of the tub, and gently clean their mouth and nose. If the baby has trouble breathing, looks blue, or is unresponsive, seek medical help immediately by calling 911. Mistake number 8, using unproven leaves, oils, or home remedies. Some families have traditions of adding leaves, essential oils, lemon juice, salt, or other folk ingredients to a baby's bathwater. These products can cause irritation, allergic reactions, or damage to the baby's skin. Especially concentrated essential oils can cause skin burns or affect the baby's breathing. Parents should also not apply medications or creams with strong ingredients or products intended for adults on a baby's skin. If the baby has a rash, eczema, heat rash, or other skin issues, talk to a pediatrician or family doctor before using any treatment products. Do you need to apply moisturizer after a bath? Not every newborn needs moisturizer after every bath. If the baby's skin is soft, not dry, and not irritated, you may not need to apply anything. If the skin is dry, you can use a small amount of fragrance-free baby lotion or petroleum jelly. It is best to apply it right after patting the skin dry, while the skin still holds a little moisture. Before using a new product on the whole body, test a small amount on a tiny patch of skin and watch for a reaction. If the baby's skin is very red, oozing, cracked, bleeding, or very itchy, you should take the baby to the doctor instead of constantly switching between different creams. How to clean the umbilical cord area. Before the umbilical cord falls off, parents should keep the area clean and dry. Fold the front of the diaper down to prevent it from rubbing against or covering the cord stump. If the cord area gets soiled with urine or stool, clean it gently as directed by your healthcare provider and pat it dry. Do not apply oils, powders, or herbal remedies to the cord stump unless recommended by a doctor. A very small amount of blood may appear when the cord is about to fall off or has just fallen off. However, if the cord area bleeds continuously, has a foul smell, leaks, pus is swollen, or if the redness spreads to the surrounding skin, the baby needs medical attention. Is cradle cap dangerous? Some newborns develop white or yellow crusty patches on their scalp, commonly known as cradle cap. This condition is very common and usually does not cause the baby any pain. Parents should not use their fingernails to pick or scrape off the crusts, as this can cause bleeding and infection. You can wash the hair gently with a newborn-safe product and use a very soft brush to gently loosen the scales once they have softened. If the patches spread, have an odor, start oozing, look very red, or if the baby seems uncomfortable, consult your pediatrician. When should you take the baby to the doctor? After each bath, parents should take a moment to look at the baby's skin. Contact your doctor or call a provincial health line if the baby develops a rash that spreads quickly. If the skin is swollen and red, or if there are blisters or oozing, the baby needs to be checked to seek medical attention. If the umbilical cord has pus, a bad smell, is warm to the touch, or if redness spreads to the belly. Parents should also seek immediate help if the baby experiences a burn, has difficulty breathing, has blue lips, is lethargic, or is hard to wake up. In particular, any baby under 3 months old with a body temperature of 38 degrees Celsius or higher needs to be evaluated by a medical professional immediately. If the baby's skin looks increasingly yellow, if the yellow color spreads down to the belly and legs, or if the baby is feeding poorly and sleeping excessively, you should contact your healthcare provider, as this may be jaundice. Do not assume that every skin change is just due to the weather or bath products. When you feel that something is not right, it is always safer to ask a doctor than to wait too long. Conclusion: bathing a newborn can be nerve-wracking the first few times. However, when you are prepared and follow the right steps, it can become a gentle, safe time that helps strengthen the bond between you and your baby. Have all your supplies ready before you start. Check the water temperature. Hold the baby's head and neck securely. Keep the bath short and dry. The skin folds carefully. Most importantly, never leave your baby alone in the water, not even for a second. You do not need to give a full bath every day. Bathing too often or using too many products can cause a newborn's delicate skin to become dry and irritated. Parents should also avoid using bath leaves, essential oils, or unverified products on a newborn's skin. If you found this video helpful, please hit the like button, subscribe to our channel, and turn on notifications to keep following our tips for safe and simple newborn care. Please share this video with families who are expecting or caring for a baby in their first months of life. What challenges did you face during your baby's first bath? Leave a comment below to share your experience with other parents across Canada. The content in this video is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If your child has unusual symptoms, or if you are worried, please contact your pediatrician family doctor or the nearest medical facility.